Afternoon, we're learning that that's a vigorous inspection which has just begun at the Kotoka International Airport as government is considering reviewing the safety protocols amidst fears that there could be a fresh wave of the COVID-19 infections as China, joining this learning, is lifting travel restrictions. Health experts say it has become crucial to get vaccinated if you haven't or if you're yet to complete the process. Well, I want to bring in now Dr. Michael Owusu, a virologist, and Charles Agbefe, who's a member of the Health Committee in Parliament. Thanks for joining us, both gentlemen. But first of all, let's take a look at our COVID-19 cases. As we speak, we'll be giving you a sense of how we're doing. But the Ghana Health Service earlier today also issued a statement, which we'll be getting to very shortly. But for now, we know that we're dealing with 2 new cases. In terms of the overall total caseload, we're dealing with an active case count of 6. But over the years, ever since we started dealing with a number of cases, we've dealt with about 171,048 cases of confirmed COVID-19 cases. That was in the past. Many of us were hoping that we would have been fast out of the woods, but where we are now, there are renewed threats of that infection coming up again. In terms of the number of persons that we've lost so far to COVID-19, it's amounting to 1,461 with some 169,581 persons recovering from the infections. Well, in the wake of the surge of some cases in China, the Ghana Health Service is equally releasing a statement. We'll just bring you excerpts of that statement while I bring in my guest for you. The Ghana Health Service has just indicated that they are equally reviewing some of the measures. So let's get to that statement and tell you what it is that the Ghana Health Service has to say about what it is that they're doing. But for now, even as we speak, the officials of the service are inspecting the facilities at the Kotoka International Airport, trying to get as strategic as possible. Some countries are also considering reviewing policies against persons who are traveling to and from China. But here's the latest from the Ghana Health Service, indicating that there has been a decline and sustained low levels of COVID-19 cases in Ghana over the past 3 months. However, the change in the global situation, particularly with reported increasing cases in China and other countries, as well as Ghana's relatively low vaccine coverage, poses a major threat of importation and a new wave of the COVID-19 infection into the country. The situation is therefore calling for tightening of the and reviewing of existing measures to avert further outbreaks. The Ghana Health Service and the Ministry of Health are critically monitoring the situation in consultation with the key stakeholders that are involved in this. We will shortly come out with our country-specific measures to address the current threat of COVID-19, especially with respect to importation. The statement continues to say that, quote, "We want to use the opportunity to encourage all Ghanaians who have not availed themselves for COVID-19 vaccination to do so." Those, of course, who have taken their first dose are to go for the second dose, and those who have taken their second dose also entreated to go for a booster. So vaccination remains the best possible protection against the COVID-19 infection. So that's the indication we're getting from the Ghana Health Service. I want to bring in now Dr. Michael Owusu, who's a virologist at the Kwame Nkrumah University of Science and Technology. Thank you, Doc, for your time. It appears that we're not out of the woods, just as many were thinking we were earlier or late last year. You agree?
Good afternoon to you, and good afternoon to all your viewers. So, well, partially, we are not yet out of the woods because COVID is like any other respiratory virus, and therefore you have to move it. It has to move from pandemic level to endemic level. So we don't have to. We wouldn't get to a point where we say that COVID is completely out. You will be having cases coming in and going down as some surges and few hotspot areas, but you are not likely to get it getting extinct as we wish to have it. So I think occasionally you will have cases come in and go out, but the extent of the cases, how large these cases come in and whether it has effect or impact on the health system is what everybody's concerned about. If you have it like any other flu, then of course it's not a problem because you just have normal flu and you can recover. But when you begin to have impact on the health system where people are struggling for ventilation and access to ICUs, that is where you want to see this as a problem. But as we speak now, the cases are as observed and as reported doesn't seem to suggest that we are there yet. And I personally don't think that we are going to get there any time because of what we have seen so far concerning this particular virus.
You're the expert here. I guess that by now you, the experts, have an idea of the traits of the virus itself. Do we know the kind of variant we're dealing with, knowing that there's a mutation likely to happen, knowing that it's coming again from China?
Yeah, so between July and December, there has been subvariants of the Omicron virus circulating across the globe, in the US, in Europe, in China, and many areas. Even in Ghana, there are hotspots of COVID cases which has been happening even in December. If you check the gene bank data, you realize that we have recorded quite a number of Omicron variants, even in December, which are circulating. What we know now is we have
Dr. Michael, also, if you can hear me, it appears we're intermittently losing the point you're making. But I want to, of course, just as we, correct the faulty lines, I also want to bring to your attention some of the decisions that China is taking. They're lifting restrictions, and there are many experts who are expressing concerns about that. What should we be doing within our own country case management system? Would you call for some restrictions at this moment?
No, we're on the variants, but as I said earlier, the variants in China are not different from what we are seeing elsewhere. These are the same and similar variant. There is only one which is called the BF7, which we have not yet recorded in Ghana. But I don't think it will change the picture even if we are to have the case in Ghana. It appears that the cases we are seeing in China seem to be circulating within unvaccinated populations who are overly elderly and above 60 years of age. These are people who are having severe impact of this disease. And because of their relaxation of their COVID-19 zero policy, where they are opening up and getting people to mix up. So these are people who have been naive to the virus for a prolonged period of time, and therefore they are becoming newly exposed to the virus, and this is where this is why they are having a significant impact. So personally, I don't see that this will introduce a wave of infection in a place like Ghana, but it's too early. If the variants seem to change and we have something new happening, then of course we can make a prediction. But based on the evidence now, as we are seeing in China and many other areas, it appears the same virus circulating, and it's because of their naive population that is why they are seeing this. So I don't think we should be looking at restrictions in Ghana as we have seen before. I think that people should be encouraged to vaccinate and to be able to promote and encourage a point where people will be more immune, so that in case we have some of the BF7 enter the country, you wouldn't have significant impact like we are seeing in many other countries.
And this is where there are questions about low coverage in terms of vaccination. The Ghana Health Service admitting itself that we haven't done as much when it comes to the COVID-19 vaccination. How do we deal with that? There are even concerns as to whether or not we have enough in supply in terms of our stock for the COVID-19 vaccines.
Yes, so this is where I think this is what we are all calling for. If you really looked into the China case, for instance, you will realize that, although they say 90% of Chinese are vaccinated, these are about 1.4 billion population. So if 10% are not vaccinated, you are looking at about 140 million people who are not vaccinated and who are mostly elderly, almost the size of Nigeria and almost three times the population of Ghana. So what it's telling us is that vaccines seem to work a lot, because the same variant in China is circulating in the UK, is circulating in America, but then it's not causing hospital facilities to be overwhelmed and not killing many people as we are seeing now in China. So if you have a country like Ghana where just about 50% of people are fully vaccinated, it's way, way below. Still, because many people don't feel it's important. I mean, people feel that the virus is still over, and people feel that nothing is going to happen. So just as the Ghana Service is calling on the population, we still have to encourage people that this virus is not just, we are not through yet. We are relying on the population herd immunity to keep us going. So if at any point in time people are not vaccinated, they only increase the risk of exposing the vulnerable population there to something that we don't expect to see. So I think that this is something that should encourage us, many people, to go for possibly booster doses to be able to keep us going as a people.
Okay, Doc, just hold the lines for us. I want you to stay on with us briefly because there's more unfolding on this matter. Also joining us via phone is Charles Agbeve, is a member of the Health Committee in Parliament. Just before I come to you, Charles, we're learning of some new measures even at the ports. The Ghana Ports and Harbours Authority and releasing a statement a couple of hours ago. This is actually from the Ghana airports as well. So it's an update on the COVID-19 guidelines for the Kotoka International Airport, and it talks about pre-arrival and arrival processes for travelers intending to enter Ghana. So the indication we are getting is that all international passengers, including those from ECOWAS region, must first of all complete a port health declaration form with a hyperlink provided to that effect of the flight to Ghana. And then beyond that as well, all persons arriving in Ghana, citizens, residents and visitors who are fully vaccinated will be exempt, first of all, from the testing done either prior to boarding from the originating country or on arrival in Ghana, except for passengers who are originating their journeys from China. So it appears that we're finally doing some review on revelers or those moving in from China. The point C talks about passengers originating their journey from China. They would be, first of all, required to present a valid negative COVID-19 PCR test results 48 hours prior to departure from the originating country. And then in addition to that, such passengers will be required to undergo a mandatory COVID-19 testing on arrival at the Kotoka International Airport at no cost. So we need to state that clearly, that it would come at no cost at all to those who are carrying out the tests. And then there's also a point about all other passengers, traveling from other destinations, originating their journey from elsewhere other than China, say Ghanaian citizens, permanent residents, and non-Ghanaians as well. Those who are partially vaccinated or unvaccinated will be required to present a valid negative COVID-19 PCR tests, also 48 hours prior to departure, similar to what's happening to those coming in from China. And then in addition, such passengers will be required to undergo a mandatory COVID-19 test on arrival at the Kotoka International Airport. And this time round, we're doing all of this at no cost. And in addition to the above, passengers may also randomly be selected and offered a test on arrival. So it continues to talk about how non-Ghanaians traveling to Kotoka International Airport with fake or foreign vaccination certificates, they will be quarantined. They'll be returned to their point of embarkation at their own cost, and that airlines that bring passengers to the Kotoka International Airport who are not fully vaccinated, or passengers originating their journeys from China without the valid negative COVID-19 PCR test results within 48 hours prior to departure, they will be paying $3,500 and I guess that will be part of their fines. But of course, getting this clear fact that Ghana is deciding to adopt this posture against China, there are concerns of a possible rift and sanctions for us, especially on countries that are deciding to go hard on China on this. I want to bring in Charles Agbeve, who's ranking on the Health Committee in Parliament. And Charles, this is where we're in a fix, of course, as to how to approach this. Many say we're varying our laws against China, which is a very, critical partner in our development. How do we approach this, knowing that there's a public health crisis looming and there's also a matter of diplomatic relations?
Very good afternoon to your viewers and listeners. First of all, I'm not a ranking. I'm a member of the health.
Apologies for that. Yes.
All right. President, when disease strikes, when pandemic strikes, it doesn't know diplomacy. Let me just go to the layman's street language. What does diplomacy got to do with the pandemic spreading into your country? We are not in the position to allow our economy to go into the kind of crisis we've been into. We cannot afford it. Listen, look, I'm happy and extremely happy the Ghana Health Service has been very proactive in taking this decision. I was talking to Dr. Bequin, the Public Health Director at the Ghana Health Service. He and the DG, the Director General, are at the airport today. Today, second. They are there making sure that what you just read as the new policy guidelines or directives to passengers are being implemented fully. And what I'm even more excited about is something we've all been talking about, that the Ghana Health Service should take over the testing of passengers at the Ghana airports. Gradually, they are moving towards that direction. And that is why it is free. Why did we worry ourselves with all this?
No one will be made to pay. No one will be made to pay for the testing.
Exactly. What did we put ourselves through in the past with this Frontier Health Service thing? How much have they rigged? How much have they made? If we had even allowed Ghana Health Service to do that at some subsidized fee, or even $10 or $20, you know how much would have helped Ghana Health Service? Sometimes I don't know why we put ourselves into these unnecessary troubles. Today we are doing it free. What is warranting us to do it free? But I'm very excited that these particular proactive measures have been put in place because what is happening in China, when you monitor, almost all countries are actually asking passengers coming from China, before you enter, you must do the testing or you will quarantine. I've seen Australia pass that policy statement. I've seen the European Union, even before Sweden takes over the European Union presidency, is tabling something on that already. And so it's become an international issue. And so Ghana cannot take the chances. More so when we are not taking the vaccine. President, during the budget hearing, the Ministry of Health and the Ghana Health Service presented to us the number of people who have been vaccinated, those who have taken the first shot, those who have taken the 2 shots, and those who have taken the boosters. We still have a lot of vaccines lying down there. We are lucky the expiry dates of these vaccines are a bit longer. Otherwise, all these monies will have gone to waste. And so, for me, once we are taking these proactive measures at the port, the diplomacy issue, we will handle it. I understand, of course, Minister of Foreign Affairs will do the needful so that we don't overly castigate those coming from China. But we must protect our citizens. They must understand. And they must help us in that direction so that we will not have the challenges we have on our hands.
And then there's the question about the capacity of the Ghana Health Service to handle this, testing regime at the airport, knowing that Frontiers Limited was handling that for us at the peak of the pandemic. Why not go back to Frontiers? After all, you agree they were helpful in detecting some of the cases at the port.
Blessed, before Frontiers came in, was it not the same Ghana Health Service who was doing the testing? Was it not the same Ghana Health Service who used their institutions and structures to do the testing, to do the quarantine, to do the surveillance? Ghana Health Service have the capacity. All we need to do is to resource them. We have the manpower. Okay, the institution, I've forgotten the name, the one at Kumasi, Nukuchi. And in fact, in Accra, almost all the teaching hospitals and secondary tertiary hospitals are testing. University of Ghana Medical Center, Nukuchi, Kolebu, they all have the testing capacities now. They've built capacity. So all the institutions and they can eat. Where we have the Ghana Infectious Disease Center, the hospital there, they have the capacity now to do the testing.
Okay, and then the last bit about $3,500 as the punitive measure for any of the airlines that will bring in, passengers who have not tested or carry out that mandatory 48-hour requirement of a negative PCR test.
I even think it's not enough. That money is not enough. You know, you need to be responsible to passengers you bring to our country. And when we put in certain directives, it must be obeyed. But we shouldn't take chances. We cannot. And you know, brother, we are in a season of flu now. You walk around, a lot of people are coughing. If you go to the hospital, 90% of the reports to our hospitals now is flu, catarrh, and this influenza. And so, if you don't take time, COVID-19 is also a flu disease. When it enters the system, it is going to be very, 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 very infectious. It is going to spread like bushfire. And so we need to protect our citizens. And that's why I personally think at the airport, the measures that have been put in place, if you are from, if the journey was from China, no matter how many vaccination cards you are holding, you must be tested again. I agree to that policy 100%.
All right.
And then also, we shouldn't just limit it to China, but we should put our ears on the ground and monitor and see what's happening in other countries, especially the Asian bloc, to make sure we protect our citizens.
All right, then.
It's very important for me. And entering a new year, we must be very proactive. And I want to commend DG and the Director of Public Health, Dr. Bequin, they didn't spend the New Year and the Christmas. I can guess they were monitoring what was happening, and that's why they've been able to put in these measures. And we will support them. My ranking and I believe my chairman are going to be supportive of these measures to ensure that the public is safe.
And we're grateful that you Yes, you wanted to land on the point there.
Yeah, hello?
Yeah, I'm with you, sir.
I'm also add that we plead to the citizens of this country. All these stories about vaccines are not true. They should take the vaccine. I've taken my first shot, I've taken my second shot, and I've even taken a booster. Today I was telling Dr. Bequin if I can take a second booster. He said yes. So I'm pleading with the citizens. Let's vaccinate. Those who have taken the first shot should go and take the second shot and possibly take them.
Right. And I'm grateful. Charles Agbeve is a member of the Health Committee in Parliament. And this is where I want to just bring in Dr. Michael Owusu, who would help us with the technicalities of this. And let's start off from the point Charles left us off on the need to take boosters and also, for those who have not taken the vaccines, get that opportunity to do so. How scientific is it that looking at this lapse in terms of time, you're eligible to take either a booster after more than 6 months since the last shot was taken? Just break that down for us. What's the ideal time frame for taking a booster?
Well, you know that earlier on when the AstraZeneca came in, we had some guidelines, concerning the vaccines, that you take the first dose and then within about 3 to 4 weeks, within about 3 to 4 weeks, you are able to take a booster dose to ensure that you have enough antibody buildup. But if you have looked at the real case scenario now, because of the ununiform supply of vaccines, it's been a bit erratic because people have taken AstraZeneca, others have taken Pfizer, others have taken Moderna. So there seems not to be any pattern when it comes to taking a dose and waiting for a certain period. So, I mean, what we know for now is that there is no any health impact as far as duration of booster doses is concerned and taking multiple doses is concerned. So, I mean, whoever has taken 2 doses can at any point in time take a booster dose. It rather has a more health benefit rather than having a disadvantage. So I would want to say that wait for 2 months or wait for 3 months. But then at least after about 2 or 3 weeks, you are fine and you can go ahead and take any booster doses, I mean, as far as you are concerned. I mean, the situation in China, I mean, as you have seen, they took their doses much earlier. I think that it's been almost about 6 months to 1 year since they took, I mean, some for those who took their full dose. And people believe that perhaps a waning immunity could account for the surge in cases among those who are vaccinated. But like I mentioned earlier, the majority are those who are not vaccinated. And these are people ranging over 100 million people because of their large population. So, I mean, in Ghana, we were much safer taking the vaccine and being protected ourselves. And I think this is a sure way to go. It's good. What Ghana is doing is more commendable. I mean, to ensure that we put in some restrictions for those coming in and doing testing and showing evidence of test before they come in. But one thing you must know is that from the evidence of COVID, you can't stop a variant from coming to the country. You do your best to slow down the rate of infection. But then, some way, somehow, you still have these cases come. So, rather, we have to encourage more people to take the vaccine. And once you take the vaccine, you are sure that even if you have some wild variants coming, you will have some level of protection and immunity to be able to at least face this virus. And also, I think it's time for us to begin to rethink about the use of masks, especially for the elderly people and people who are living in closed circles where they are likely to be exposed. So it's a bit too early, but then when we begin to record cases and possibly have new variants coming into the country, the best sure way is to combine vaccination together with masking.
And there are questions as to whether or not that should be made mandatory.
It's too early. I don't think now we have. I mean, we don't have cases, and I am also saying that for now, the variants we are seeing in China are the same variants which are in Ghana over 6 months now. It's not urgent. It's not more concerning for us now. But then, we have to monitor to see how January and middle of February will be like. If it remains like this, then of course it means that we don't really need to worry ahead. But then, if in case we have new variants coming and cases begin to surge, then on top of the vaccination, we need to have another layer of protection, which likely will be the reintroduction of masks for us. But now I don't think it's necessary. It's a bit too early to begin to think about this.
Well, we'll see what the proactive measures, to what extent they'll be helpful at the ports, but I'm grateful, Dr. Michael, also for joining us, virologist at the University of Science and Technology.